It's a national crisis. Each year, more than 70 million post-surgical patients receive opioids. Research shows that 1 in 15 go on to use these medications long-term. But there are alternatives to effectively manage pain after surgery. Dr. Scott Sigman offers his patients a combination of non-opioid medications. Good morning, doctor.
Good morning.
Frame it up for us before we get to your approach. Add some context to this huge problem. How did opioid use become what it is today?
Yeah, so great question. So as an orthopedic surgeon, I operate on people routinely, and as we all know, surgery hurts. It's a painful process. And as doctors, we want to try and guide our patients through that surgical experience, really minimizing the pain that they experience. The problem is that the gold standard has always been opioids. And as you correctly stated in the intro, that 1 out of 15 patients will go on to long-term use that have been exposed to these opioids. And what that does is basically fuel this horrible opioid crisis that we're seeing across our country. So we're really trying to come up with alternative methods to try and treat our patients.
Okay, so what are some of those options, both traditionally and then also what you're doing, what you offer to patients?
Yeah, so in my clinical practice, I'm using a new medication called Exparel. So, for example, if you go to the dentist will use a numbing medicine and do the procedure, and you usually get pain relief for an hour or two. There's this new medication that we actually use. It's a longer acting form of numbing medicine. It's injected at the time of the surgery, and it can provide upwards of 2 or 3 days of significant pain relief. So believe it or not, Mary, if I do a total knee replacement on your mother, let's say, and she is the day of the surgery, literally that afternoon, she's walking down the hallway with a walker telling me that she's having minimal pain.
Wow.
We're mobilizing our patients faster, and we've seen a dramatic reduction in the need for post-operative narcotics.
Can things also be done before or during surgery to better manage pain instead of just addressing the post situation?
Yeah, I think that the most important thing you can do prior to surgery is to have a conversation with your doctor about what the plan is going to be. My take-home message today is I really want the patients and the viewers out there to realize that they have a choice. You can help to direct your care. Ask your doctor, what are the alternatives out there other than opioids? And if you're not sure of what questions to ask, there's a terrific website, patientdiscussionguide.com, where you can actually print out those questions, bring them with you to the doctor's office, and actually start the conversation. Really, that's the message here. We want our patients to be educated, to let you know you do have choices.
Some people might be reluctant to do that because they feel like they're telling their doctor what to do, sort of like, well, shouldn't I just trust them to do their job well? What do you say to help ease those concerns if patients have them?
So we're educating doctors too, and that message is loud and clear. We really are trying to make sure that the physicians and doctors recognize this crisis that has developed. We're changing the way in which we think, our prescriptive practices, how we're putting out medications. So the doctors understand that this is a problem, so don't be afraid. We expect you to. I have a conversation with every single patient that comes into my office as to what my expectations are for postoperative pain, and I ask the patient what their expectations are. We work together, develop a plan. It's a team approach that really works well.
Patientdiscussionguide.com. Dr. Sigman, thanks for joining us today.
Really appreciate the opportunity.
It's our pleasure to have you. Mike?